So during pregnancy, we want to avoid any foods that can lead to a potential risk of the developing fetus. So for example, that would be like high mercury fish. So these are going to be our large fishes like shark, king mackerel, and marlin. And that's because they have higher levels of mercury, and this can build up in the baby's brain or the nervous system and potentially lead to brain damage. We also want to avoid any foods that can potentially lead to a foodborne illness. So these are going to be foods that have bacteria. So like our raw undercooked meats, our unpasteurized dairy products, our soft cheeses such as like brie or feta, deli meat or hot dog as well. So we want to make sure we are properly cooking all these foods to the correct internal temperature, or just completely avoiding them if we're most comfortable with that. We also want to make sure we're properly washing all of our produce, practicing safe hand hygiene when we're preparing our food. We also want to make sure that we are completely avoiding alcohol, staying less than 200 milligrams per day of caffeine, and trying to limit our intake of artificial sweeteners to less than 2 servings per day. If in doubt, always just ask your healthcare provider or a dietitian. So during pregnancy, we really just encourage eating a balanced diet. So we want to make sure we're eating all of our food groups. So that's going to be our grains, preferably whole grains, our lean proteins, our fruits, our vegetables, dairy products, as well as our unsaturated fats. We want to limit our intake of like simple sugars like candy or soda if we can. You want to make sure you're eating an adequate amount to meet your body's calorie needs. So having 3 meals and snacks if needed, and really just taking our prenatal vitamin and just focusing on eating the balanced diet, and that should meet all the nutrient needs you need. So during the first trimester, our calorie needs do not change. Once we hit our second trimester, we do need an additional 350 calories a day. So that could be an additional snack of like a peanut butter and jelly sandwich. Once we hit our third trimester, we need an additional 450 calories a day. So we might add an additional snack of having a cup of yogurt with half a cup of fruit and an ounce of walnuts, and that should meet those calorie needs. If we are having a twin pregnancy, we do want to start having an additional 500 to 600 calories per day in our second trimester. So during pregnancy, the most important vitamin is going to be our prenatal. We want to make sure we take that as soon as we find out we're pregnant or during the time of trying to conceive, and we want to get one that has folic acid in it to help prevent birth defects. As well, we want to make sure we're consuming an adequate amount of iron. So we want to make sure we're having our animal products, our leafy greens, beans, and we can also pair those foods with citrus foods. That's going to help the absorption of the iron. Sometimes we might need a little bit more. At that point, your healthcare provider will let you know, and you might need to take an iron supplement. And as well, omega-3s are very important. So that's going to help with brain and eye development. So that's going to be, things like salmon and tuna. But other than that, a balanced diet along with the prenatal should be enough. So currently there are no strategies to ensure that your unborn baby won't have food allergies. What's recommended is just to eat a balanced diet during pregnancy, and then once the infant begins eating solids around 4 to 6 months of age, you would want to start introducing those common allergen foods a few days apart to assess if they're having any reaction, and just to make sure we're giving them a balanced diet as well.